Hello guys, I hope you're doing okay. I hope you're having a great time. Today we're going to talk about premature ejaculation. It is one of the most common sexual dysfunctions in men. It affects a large number of men at some point in their lives, as up to 1 in 3 reports having suffered from it at one time or another. It is characterized by ejaculation that occurs consistently or almost consistently before or within 1 minute following vaginal penetration, with an inability to delay it during most sexual encounters. This situation leads to negative consequences on personal life, such as distress, frustration, or even a tendency to avoid sexual intimacy. There are two types of premature ejaculation: primary or lifelong premature ejaculation, which has been present since the first sexual experiences and occurs almost always, and secondary or acquired premature ejaculations, which appears after a period of normal sexual activity without ejaculation problem. The causes of premature ejaculation are not fully known, but they result from a complex combination of psychological and biological factors. From a psychological standpoint, several elements can influence this disorder. For example, early sexual experiences or a history of sexual abuse can have a lasting impact on how a person perceives and experiences their sexuality. Poor self-image, lack of confidence, or fear of not being adequate can also exacerbate the problem. Furthermore, anxiety related to sexual performance or other aspects of life, as well as feeling of guilt, can lead a person to rush the sexual act, making ejaculation control more difficult. Tensions and conflicts within the couple may also play a role by increasing stress and reducing emotional comfort during intercourse. From a biological perspective, some men may have hypersensitivity of the glands, which makes stimulation more intense and accelerates ejaculation. Imbalances in neurotransmitters, the chemical substances that transmit signals between nerves, can also influence the speed of ejaculation. Hormonal disorders may also be involved, affecting the functioning of the reproductive system. Other factors can also worsen premature ejaculation. For example, men suffering from erectile dysfunction may, out of fear of losing their erection, rush sexual activity, which promotes rapid ejaculation. Excessive consumption of alcohol or psychoactive substance can impair control over sexual reflexes and worsen the problem. Premature ejaculation can have a profound impact on man's emotional and relational life. It can lead to severe psychological distress, decreased self-esteem, and feelings of frustration or failure. Many men experience the loss of self-confidence, fearing they are not adequate or that they may disappoint their partners. This anxiety can in turn aggravate the problem, creating a vicious cycle that is difficult to break. On a relational levels, premature ejaculation can be a source of tension within a couple. Lack of sexual satisfaction can lead to misunderstanding, frustration, and sometimes emotional distance. In some cases, premature ejaculation can also complicate conception, particularly if ejaculation does not occur inside the vagina. This can add extra stress for couples trying to have a baby. Well, the treatment of premature ejaculation relies on several approaches. It is important to note that it may take time to find the most effective method or combination of treatments for each individual. Let's start with behavioral therapies. Certain techniques can help improve control over ejaculation and prolong the duration of sexual intercourse. Among them is the stop-start, which consists of interrupting sexual stimulation just before ejaculation, then resuming after a short pause. Another technique, called squeeze method, involves applying a slight pressure to the base of the penis when ejaculation is approaching in order to delay its onset. Other simple strategies can also be helpful. For example, masturbating an hour or two before sexual intercourse can help improve ejaculation control during the act with a partner. Secondly, a weakened pelvic floor muscle can make it more difficult to control ejaculation. So, Kegel exercises, which consist of regular contracting and relaxing these muscles, can help strengthen this area and improve ejaculation. Condoms can also use to reduce the sensitivity of the penis, which helps delay ejaculation. Certain specific models, slightly thickened or containing an anesthetic agent, are designed to prolong the duration of sexual intercourse. When it comes to pharmacological therapies, there are medication options available depending on the patient's needs and preferences. Some antidepressant, particularly selective serotonin reuptake inhibitors, have the side effect of delaying orgasm. Medications like paroxetine are used to help prolong the time before ejaculation, and duloxetine is especially indicated for the treatment of premature ejaculation in men aged 18 to 64 who experience an intravaginal ejaculation latency time of less than 2 minutes and a significant personal distress. However, side effects may occur such as nausea, headaches, drowsiness, and dizziness. Certain medication used to treat erectile dysfunction can also help manage premature ejaculation. These include sildenafil, tadalafil, and vardenafil. These treatments improve blood flow to the penis and increase the duration of sexual intercourse. However, side effects may also occur, like headaches, facial flushing, and digestive disorders. There is some SSRIs containing lidocaine and prelocaine, which can be applied directly to the gland to reduce sensitivity and prolong the time before ejaculation. These topical treatments are useful for men who have difficulty delaying ejaculation due to the hypersensitivity. In addition to these medications, it is also important to consider the underlying psychological factors that may contribute to premature ejaculation. So consulting a sexologist or a psychologist can be beneficial to address emotions, fears, and anxieties related to sexual performance. I hope these informations were helpful to you, and if you have any question no matter what, please leave them below. Thank you so much for watching till the end, and I hope to see you in the next one. Bye bye.